how an athlete and how an individual can help get that mental clarity, focus for their brain, and how do you actually measure what works and what doesn't work?
I think about an athlete that has to perform. He has to be present. He has to be in that moment. And we can call that, in one sense, focus. And if you think about it, focus is a mental capacity. It's part of your cognition.
Do you have them do it like post-game, pre-game? Is there a certain routine that you recommend that would be best suited to see what the attentional focus looks like?
When you focus, it's a totally different thing. So you have to be on your game. I do my morning stretching, I do some yoga, maybe I'll take a jog, I drink a couple cups of coffee.
So let's say you do the red light around the head, you jumpstart the brain. How long does that last? Like how long can you stay focused with that?
And I was like, hey man, this is nerve regeneration, so why don't we do it on the head?
We're an active player who's playing college or pro sports, and you get a concussion, you're in concussion protocol. Is photobiomodulation, infrared technology being used during concussion protocol? And obviously, I think the answer is going to be, yes, it should be used, but is it being used?
Yes, it is being used. I can't say for 100% that my devices are being used in there, but a lot of devices are being used within the professional ranks. That is probably like called a trade secret.
All right, on today's episode of Neurovision Edge podcast, we have Dr. Joe DiDuro, and I'm super excited because he's going to talk about how to actually measure and see what things help your focus, your mental clarity, and your brain. This is an aspect that athletes ask me a lot about, but I have a lot of athletes I work with virtually, and it's hard to assess what actually helps them versus what they feel like helps them. And so Dr. DiDuro has something that is super exciting that he's going to get into where it actually can measure what helps your brain. And that is super exciting. But before we dive into the episode, please subscribe and make sure you're notified for our podcast, because the only way we can get great guests like Dr. Joe is because more people listen. And so if you're not subscribed, make sure you subscribe. All right, without further ado, Dr. Joe, can you please get into how an athlete and how an individual can help get that mental clarity, focus for their brain? And how do you actually measure what works and what doesn't work?
Well, that's a big bite. So let me take little bites of it if I could. So when I think about an athlete that has to perform, he has to be present. He has to be in that moment. And we can call that, in one sense, focus. And if you think about it, focus is a mental capacity. It's part of your cognition. And it's really important for our survivability because we had to listen to a sound and focus and see what was going on so we could react. And if we're distracted, then our survivability would go down, right? Something could attack us and we would miss it. It's a natural technique, but in the world we are overcome by distraction. So the way I see it is like, right, we have a measure with a handheld app that you can do anytime, anywhere, and it's a baseline 3-minute test, and then we can break it down into smaller gaps. But really, it gives you a measure of your attention. Can you sustain your attention for 3 minutes? And it's actually the most documented, test that you can do in an office for mental fatigue. So you have to kind of say, like, I did everything right, that I get up to the plate and nothing happens or it happens wrong. That's really what we want to do, be able to act under pressure. I think that the metrics that we have gives us the ability to say, yes, I'm in the zone, or no, I'm not in the zone. And what can I do now to kind of recover that? So that's kind of a lot of the stuff that we're going to kind of walk through today.
Can we break down the difference between attention and being in the zone? Is it one of the same? Or what is the difference between, because in the zone is like this very catchphrase term, but what does it mean to be in the zone?
So, it's a question that comes up and I think people can kind of fumble this. And the reality of it is being present is when you're focused, right? It's like looking at the fire. You're looking at the fire and you're just looking at the fire and then you look up, right? And then you look back down and then you look up. And so you don't really, the flow is right there near being 100% present because you're also looking at around you. So it's kind of like that edge is kind of what it feels like. Think of it this way. In the inside, it's your thoughts are on task or your thoughts are off task. And that's really what happens in the brain as you're trying to stay focused. If you're not, looking at the pitch and all this stuff or, getting ready to make a putt or however they want to do this, it doesn't happen slow. It can happen fast, but the flow is having all your mental capacity focused on the present moment, and then that moment, and 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 then come off it, and then go back in, and then come off it. So it's the flow is like your abilities and then your competition. And when they just a little bit like that, right? So if you come in and your ability is low because, you're fatigued or you're burnt out or you're not breathing or whatever, that all those things can affect it. What you show up with that day is what you got. And now how do you optimize where that state so that you're present and then unfocused and then present and then come back? And so you need a little bit of a challenge. And so I think of it like the F1 driver or the skier. If you must react in that moment. If you turn too fast, you're in the wall. If you turn too slow, you're in the grass, right? Or you hit the thing. So that's that state of heightened awareness, but the quiet eye, all the things that you talked about, in your reels and stuff like that. That's sort of the sense. So you have to be ready. You have to have the ready state. So if you're hungover or tired or anything like that, we know that from the data that you cannot pay attention and your endurance goes down. Your ability to do the test is really a clinical test of mental fatigue or sleep deprivation. So that's kind of the whole scenario. So you have to kind of prepare yourself for the moment, and then you have to be present in that moment. And then that's when the competition happens, you against them or you against you.
So would you say that, because this is a highly complex topic, flow state, right? There's so many, this alone is like 10 podcasts worth of information. But if we try to summarize it in a basic way, you're saying attention is thoughts that are on the task at hand. And then flow state is brain being fully optimized with the body and also having the thoughts on hand. So having the full attention while having the body and the brain optimized on the task at hand. And that's
correct.
When that's when athletes can get to flow state.
And the challenge is it can't be too great. The challenge can't be too great above your abilities, or it can't be too low, or it's too simple and you can't stay engaged. So that's why great teams have great games, because it's them challenging their competition against my abilities and their competition against my abilities. Look at the boxers, right? Look at the boxers. They're going through so many series of thoughts and actions and routines, and you have to be present to let your consciousness get out of the way. And so that's sort of the big leap. Is they say competence, right? That's what it is. It's confidence, but really it's having fully trusted your preparation and your capacities and your intuition and all those things that you trained for. You're not supposed to think your way through it.
So how do you stay present? How do you get that full attention?
Well, I think it's part of it is it's a great tool. Like doing the app is a great tool for paying attention. If you're doing the test, it's a 3-minute reaction time test, right? And so you're just looking at it and you're tapping it, and it'll tell you at the end, like what your score was and what your performance score was and your errors and your lapses and how much you were jittery, you flinched and went too quick. And then you can say, okay, this is my score. And then you can just kind of think about, well, did I spend, you can find when your mind is wandering, you're like, oh shit, that was the thing, and oh, there's the number. So it's immediate feedback, and it trains you to just stay focused. The doorbell can ring, the people can talk to you, but you're focused on your task at hand, and that shows in the numbers. So let's say you're Bob, the relief pitcher, and they say, Bob, you're in, right? Well, how do you go from sitting on the bench to warming up and then going and being present? I mean, there's a lot of that mind skills, but this is a measure, and it goes along with a lot of measures that you can take, on your biometrics and things like that, to say, I'm ready physically, and now I'm ready mentally, and now I can get into perform, So all those little tricks, but I really truly believe that the eyes, that is where it's all going to happen, because that's where you take in a lot of your information. One of the things that happens in the flow state, I think you can kind of buy into this, is that it's a time thing, right? So you don't have tunnel vision, you have a fuller vision, right? So that you see the movements of everything around you. So you're, like you said, your eye has to stay on target, and then you see the things moving around, and they move their head, right? And they don't really, their eyes aren't jumping around. It's their head and their body. That's kind of like a story about how this thing works. It's kind of the sort of part of it.
So, let's say they use your app and they get this data that shows their attentional skills or how good their attention is. How do we use that to make the attention better?
That's the whole point. So I know a lot of athletes that use the whoop and the rings and everything like that, and they don't look at their, I got a bunch too, they don't look at their data. They don't want to look at their data because why? Because you can't go back and re-sleep the night, right? You can't go back and prepare better. You prepared, and that's it. But what can you do in the now? Because we're about the now. So that's kind of the scenario that if I'm slow, like if you can see on the different metrics that you're slowing over time, which is like an energy reserve thing. You kind of a little bit tired, burnt out. So a lot of people, that's why they used to chew tobacco, right? Nicotine, that's baseball players used to chew the tobacco. Nicotine is helps your focus. Coffee, right? But what they also find is that you can do, let's say you're not really an athlete, but you're, an executive, and you got the big international meeting coming up. So you had to stay up a little bit late, something like that. Well, you don't want to take the coffee because it can kind of screw up your night's sleep, and then you're not ready for the next day, what have you, or jet lagged or something like that. So one of the things that you can do is jump rope, kind of
jump rope. Okay.
wakes people up. This is what they found that will increase your reaction time, your ability to focus. So, a stimulant is part of it, but that's short lived. What they find is that these mind body activities, and you see them a lot now. You saw it in the F1 movie, bouncing the balls. You see everybody doing that now, and they do the eye training and things like that.
Mm-hmm.
But again, you have to have the right dose. So if you're fatigued and you try to do some of this stuff, you could really kind of overpower the system. And that's sort of what we studied in, I'm a chiropractic neurologist, and I also have a master's degree in clinical research. I focus on neuroscience and the brain, my book, my, medical device company, all that stuff. That's sort of what we kind of paid attention to back then, was the metabolic rate. And the book is called My Brain Matters, the Neurometabolic Solution. So it's a big title. Maybe I messed it up. But the point is, you have to have the metabolism. You have to have the system in place to, when you hit the gas, you've got the juice. That's basically it.
Now, let's say, because I'm thinking about like application-wise, how can we get an athlete to have better focus? So what I'm thinking, and let me know if this makes sense, is we can use, let's say, your app that will tell us the attentional score. And then they can do, let's say, use NeuroGum prior to, and then take the score. Let's say they can do the jump rope and then take the score. Let's say they do a meditation routine and then take your score. Or let's say they do binaural beats or some sound and then take your score. And then can they find out, like, hey, if I do this, this improves my attention. So before the game, I need to be doing this.
That's 100% correct. So all the stuff that we're doing, think of them when they were stretching and moving, they're getting the physical ready, but that's putting everything in sync. And so it might be very important, depending on their mental state, like how hyped up do they have to be? It's not a group thing. Like I see these guys get in the huddle and start screaming at each other before the game. That might be good for some people, but it might be bad for others, right? So let's kind of get a little bit of an information gap on the individual. What's good for me? Maybe I'm coming in hyped, and if I'm super hyped, I get to be anxious, and then it's difficult for me to perform. So you're absolutely right. The beauty of this is that in your hand, Fitbit for your brain. Like you could wake up and take your score. It should match how you slept. Everything kind of goes together. And then you have to burn up your energy throughout the day doing whatever you have to do, right? And then how am I doing when I'm ready to perform?
Right.
And if I'm not up to speed, yes, like they say, like the methylene blue, right? Well, how do you dose that, right? How do you know did it work for me? Like all these supplements, you can, it's okay if it's a placebo and you think it made you, more concentrated. Maybe it didn't. Maybe you needed 2 shots.
That's such an interesting point. I want to go back a little bit on one of the first points you made, because I think people need to hear this one more time, is that not everything works for everybody, right? It needs to be individualized. So this could be one aspect where, like a Whoop, like everything else, you can test to see, what does my body work with, right?
That's right.
How can my attention be better? And so you can individualize what works for you, because every single person is so different that like methylene blue will do nothing for somebody and make some people worse and then make some people better. So that's super interesting. I like that there's a testing component. But let's say for someone who doesn't know how to test and how to do like a clinical study like this on themselves, how would you recommend they go about using that app that you have or using technology that will help them with things like attention and focus?
So it gives you your reaction time as a speed component. So we have like 6
Okay.
different components that are displayed for you on the app. Let's just put it this way. If you go 10 milliseconds or let's say 20 milliseconds, that's like being a coffee, right? And so you need like 100 and you need like 3 Red Bulls to get like a 20 millisecond increase. And it takes, caffeine takes 20 minutes or so, maybe 60 minutes to kick in. So you're kind
Okay.
of in trouble, right? So yes, you could put the stimulant in there. You could put the gum, let's see, because this is a no bullshit test. You're either
Right.
going to get better or not.
Yeah.
And maybe you're going to deteriorate over time and things like that. So what I said is it's basically, let's just get down to the brass tacks of just a touch here. So what you're really reading when you're doing the neurometrics test is how the system is, your brain parts are working. If you are tired, you have receptors that are full up of gunk, basically. And that's why the jumping up and down and the mind body and the breathing and everything like that kind of is pumping that, helping the fluid kind of flow through your brain, basically. So we're big into the lymphatic system, and it seems to have this, it's all connected with the brain.
Yeah.
So basically, you want to see how you're doing in the morning, and you want to see how that related to your sleep. Then you're going to start the day. And it's really about optimizing today and then optimizing tomorrow and then optimizing tomorrow. Because it's not like you're going to get super, like you take amphetamine, like that's what they give to the military. They'll give them amphetamine so they don't have to sleep and they can stay awake and perform their job. But that's going to have consequences, right? So that's kind of my perspective on it, is that you have to get this thing going.
So you want them to do it first thing in the morning. Then is there, for fatigue, measurement for fatigue, do you have them do it like post-game, pre-game? Is there a certain routine that you recommend that would be best suited to see what the attentional focus looks like?
Yep, I think that's fine. I think that's a great way to do it, is to just kind of hone in. You know what you're going to be, and then let's just say you do whatever your morning routine is, right? So you can kind of, when you start scrolling, let's say, right? And we're going to talk about maybe this dopamine and everything, but I think it's overrated. I think that they're missing the brain chemicals, right? So they might get this stuff wrong. Okay. But when you're scrolling, you're really not thinking about any. And that's kind of like the distraction part. So you're just like engaged, but not really engaging that much, right? So we don't know if it's the blue light that's doing it or the chemicals or dope, who knows, right? When you're focused, it's a totally different thing. So you have to be on your game. So like I say, is I get up, I do it in the morning, and I see how things are going and say, oh yeah, that kind of is in my norm, or it's very low. And then I'll do some morning. I do my morning stretching. I do some yoga. Maybe I'll take a jog. I drink a couple cups of coffee, and let's say, hey, let's see how that did. And you see that, just waking up, you don't have the alertness of, like, say, after a jog and a cup of coffee. So you know where you're at. And then you can kind of go with that throughout the day. Like, how am I doing? And it's like, oh, I'm really running out of gas here. Maybe I'll take a minute, maybe take a breath, maybe splash cold water in my face a little bit to see if I could do. The thing that makes the biggest jump, putting the lights on your head, right? The transcranial photobiomodulation pumps the blood into your head, kind of pushes that stuff around, and you can jump. We've seen this almost every time, like 35-second improvement, 35 millisecond quicker. So that's like being completely awake. You're at your max.
Quick segment break, but you're going to want to hear this. If you're an athlete, coach, or parent, and you want faster reaction, this is where we start. This is called vector ball. This ball unpredictably bounces and it changes colors, red, green, or blue. We use this to sharpen the reaction time, focus, and coordination. And here's what makes it different. Whenever you see a different color, you can assign it to left, right, pass, shoot, adding a cognitive load, meaning that frontal lobe, while you're moving around, is making faster decisions. We use this with athletes every week, and we hardwire this decision making. Train your brain, train your eyes, dominate your game. Grab the vector ball in the link in the bio or scan this QR code to get started. Let's get back to it.
So you've tested this on yourself, I'm guessing, for a long time now. So would you say the transcranial photobiomodulation or the red light in the skull, that seems to be the best thing for attention and focus?
That's what the research has said over the years. And that's what we find consistently with our clients and with our data sets, is that like we'll put people into bad positions, right? And then, or make them not do not sleep, and then get their measurement and then put the lights on and boom, get them back to the lights come back on, the juice comes back on. And that's basically because it's, making everything kind of pump out some of that gunk so that the system can accelerate. That's sort of what's going on. So the vessels can move more, the blood can flow more, it cleans out that system. And that means the mitochondria can really accelerate. And that means you can have attention to be focused. And that's kind of how it works.
So let's say you do the red light around the head, you jumpstart the brain. How long does that last? Like, how long can you stay focused with that?
Well, that's a great
Is that
question.
dependent on the person?
Well, it's all dependent. So let's just back up for a second and say two things. So one is regular use of the red and infrared light, because it's kind of the infrared that gets in there deeper a little bit. We've had an autism study that we just completed and presented it last month, where for every day that the children used the lights, there was a 0.1 change in their non-compliant behavior and in parental stress. So basically, it's a cumulative effect, okay? Because it's training the system. It's the same thing when you do jumping up and down or exercise. It's pumping the brain, it's pumping blood into the brain, it's raising your heart rate, and that gives us the washout that we need to come back a little bit. Other things are like receptors and, things make things fire faster, things like that. But for the biggest changes that we see are the mind-body type of connections, juggling, doing things like that, or the breathing helps to pump that too. So that's kind of the scenario. And with the studies that we've been doing with a lot of these studies is the residual of this photobiomodulation. We can see that for up to like 1, maybe 2 hours. Nobody wants to sit around with this stuff strapped on their head for 2 hours. But when we do our continuous monitoring and we get the different type of it, not these ones, these are more of a summary, but we get the granular data. We see this drop in stress level like immediately when you turn on the lights, and then it sort of stays for a while. So that is definitely something that we still need to investigate. But there's two different things that we want to touch on. That chronic use increases the system, just like exercising regularly keeps the vasculature going. And if you stop doing it, it decreases. So that's like on a monthly basis. But on a daily basis, we recommend that people do the lights twice a day. So first thing in the morning to kind of loosen everything up, get it flowing. And then first thing at night to help them sleep better and raise their HRV and get more deep sleep and things like that.
Now, is this something people have access to? Is this like the Parkinson like cap where they have the red light units? Does that actually get to the areas of the brain that we need them to?
I think you should see my lights. My lights are a lot more powerful than that thing. And I actually had my devices, we made the first pan whole head photobiomodulation device back in 2017. There's the original recipe, and then there's guys that come behind us. So you're absolutely right. There's there's a little bit of camps in this. Does the light go through? Does it not go through? And
yeah,
you have to kind of eliminate the dogma and look at the reality of it.
That's another way you can test it, right? With your app, you can see improvements. And if there were no improvements, that means the light is not really penetrating and doing anything. Would that be correct?
Let's just talk about that. That's 100% correct. And so you have to kind of ask yourself about the dosing. So it's the same scenario, right? If I take, let's say you see these people walking around with Red Bulls and Monster Energy and all this stuff like that. And it's so temporary, right? And it's just showing you that you don't have the juice. You have to metabolize all that stuff. But it tells you that I don't have the juice, but it is a way to dose it. So you can dose it. Like if you ask somebody, are you tired? It's like 100% wrong. Asking somebody, are you sleepy, or giving them a questionnaire is about the worst type of representation that you could get. It's like when we used to take care of our dementia people, we'd say, well, what do you see better? She's sleeping better. I said, how do you know that? Well, she doesn't wander around. I said, well, how would you know that? Because she sleeps in the other room. And I realized we can't track people this way. We have to get the data from them. This is back in the early 2000s, but before we had this sort of, trackers that everybody had on their arms. So that's why we take that data in, put it in our dashboards, and give these people the recommendations to change these things. So I know that we're talking a little bit about how do you know, does it work? But that's kind of a little bit of the physiology and the neurophysiology of how the brain works. But the reality of it is, just put the light up there, the brain will know what to do with it. And if you have a measure, like we've always told people since I've been doing this, and this is from 2007 when we started using lights on people with neuropathy. And I was like, hey man, this is nerve regeneration. So why don't we do it on the head? Right. And that's how we sort of started to roll with this thing. But the scenario is we should just do it 20 minutes. Like what was that?
That's what we hear all the time. 20 minutes.
20 minutes. And I'm the guy that gave that number out. I'm the guy that started telling them, do it for 20 minutes. And that was based on some physiology and how long nitric oxide stays in the blood and blah, 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 and your reserve. So there's a lot of things that influence the results at the end. So is your capacity to vasodilate? Is it your nitric oxide supplies? What happens to what's the stiffness in the vessels? What's the venous system doing? So there's a lot of things that are going into this that we can't really say, well, you can always do more, right? You can always do more, but there's a time dependency and that sort of stuff hasn't really been worked out. But the point is that when we see people with long COVID or, like mild cognitive impairment, they're going to go up in like a few weeks. They're going to raise it to like 40 milliseconds. So their brain is getting faster. It's processing it. So it may not be that they're going to go from zero. Of course, this is with photobiomodulation, which is a very powerful way to change the brain and to change your brain's reaction time and your attention. So this is kind of the best thing that you could do for it. So you're not going to go from like a speed of like 350 milliseconds to 150 milliseconds. You're going to jump that much because that's not really the way the nervous system works. It's going to go a little bit.
Right.
So
but there's progression where it's getting better and better and better.
That's what we see. And this is good for physiology. This is good to understand how it's going to work and give the people feedback. I just want to say one thing. So if you are sleep deprived or if you have sleep apnea and you're not getting good restorative sleep, you will fail this test. And it has certain numbers. There's a certain signature that it looks like. So these people, no matter what they do, we have to kind of adjust that so that they are doing this properly and understanding how we work on their respiration muscles and the glottis, and we put the light down here so it tightens up these muscles and, helps that area regenerate. So just want to say that there's a lot of components in this, but that's mental fatigue. That's where it starts, by not getting restorative sleep. So that's sort of all kind of sits in the same brain, basically.
Can I share something personal?
Sure.
So I have severe sleep apnea, and I also don't get good sleep because my son has special needs and he's stomach tube fed and he has a cognitive genetic issue. And so, thinking about this in both realms, along with helping my athletes, but also thinking about it for someone like myself who's pretty much in a constant non-restorative sleep pattern. And then also in terms of improving cognitive function for, let's say, a child who has autism or, a genetic predisposition or cerebral palsy. I mean, it sounds like there's a lot of applications here where you can use the photobiomodulation and test and see if it actually is individually helpful.
Let me share with you how this works. So this is what we did with the autistic kids. We tested them for their home situations questionnaires, which is non-compliant behavior. So social inflexibility and demand specific tests, like, go to bed or do this or do that, and everything. We put the lights on their stomach, their gut, and then on their head, right? And it was amazing because and what we found was that 60% of the kids had sleep problems. And if a child has sleep problems, that's a double-edged sword, because then that means nobody in the family sleeps. So the parent has which is the caregiver, and we're a very caregiver-centric company, right? So just as that, we kind of feel for them. So we used to tell the parents, look, put the lights on when you're not running around after these kids. And what we found is that every day the compliance, their behavior got better, the parental stress went down. These are numbers that have, 0.000, everything significant, numbers never seen before. So you're absolutely right. The system kicks in. The brain heals in the sleeping state. And that's why if you can assist the brain in its sleep and help clean out that stuff and help the gut, because the gut, that's the toxins, and it goes back up, it goes back down and everything like that. So that's what we find.
So the kids slept with helmets on, or
No,
was there an overhead light?
No, not yet. No, we did that. We have a couple different devices for that. We have an infant wrap that we put around the babies that when they're feeding or playing, so it'll turn on their gut and it'll turn on their head. If a child has sleep disturbances from 0 to 12 months, that means just waking up a lot. And we know kids are a lot worse than just waking up a lot. They're screaming, they're jumping, they don't want to go to bed, they don't sleep. Just more nights awake or 20 minutes to fall asleep will show autistic symptoms at 24 months. So that's the same story. Like, oh, my kid was good till he turned 2. And then everything went, no, that's not how it goes. They're sick beforehand because they have this toxic burden. So that's kind of the scenario is they put the lights on, the kids would fall asleep immediately. So everybody's sleep got better.
I'm not sure I still understand. Is the light overhead, or is it
the light is on the head? I can show you.
The kids let the light stay on the head?
Sure. Now, if we had, because here's what happens. We start with it on the chest, and it's so warm and so nice, and so and there's infrared, which is like a hug, so it's automatically a sleep aid, basically. And then we put it up on their head, and you see pictures of these kids with, sometimes the helmet would be big, sometimes they had a strap. And if the kid was completely non-compliant and couldn't touch and didn't like anything like it, we'd wait till they went to sleep and then we'd stick it on. So, but then after that, everybody got normalized. I mean, if I tell you, we're waiting for the final statistics on this, but these children, I would look at them and they would have no sleep problems afterwards. And then I said, I wish we had a measure of like their autism levels. And as a matter of fact, one of the outcome measures that we used was the Autism Parenting Stress Index. When they did the Greek translation of this Parenting Stress Index questionnaire, they showed that like, here's an autistic kid's level, here's a neurodevelopmentally disabled child, and here's a normal child. And actually, the parental stress level went down to what would be considered normal, a normal child. So that's just one type of a measurement that we had. Because I'm like talking to these people and seeing the results and, listen to their glowing responses. You say, I don't think these kids have autism anymore. That's a big statement, but the numbers are the numbers.
Right. That's super interesting. If we take it back to an athlete, right? How many pro athletes are using this type of technology with the infrared technology or the photobiomodulation to enhance their ability to have better cognitive function?
Well, let me put it to you this way. I'm going to give you a couple of tips, and I'm going to share something personal. First of all, I used to be the worst snorer in the whole world, and that's not a good sign. And what people don't realize is I had a lot of traumatic brain injuries from sports and running around and being a young kid. So as soon as you hit your head or, you have a concussion of any type, your sleep is messed up. And so these kids can go on, you can have bad sleep for decades if you don't repair the problem. So let me just explain it to you this way. Many older athletes, right? The concussion you get at 70 turns into the CTE. So the concussion you get when you're 7 turns into CTE when you're 70. So a lot of retired athletes and, professional athletes are doing photobiomodulation in large numbers, like our devices and a lot of companies out there, because it helps them with their traumatic brain injury or even the PTSD types of things. So it's being used by pro athletes because they have damage from contact sports. So if I get to be a professional athlete, the ones that make it and perform well are genetically gifted, but they're also metabolically gifted because, you're going to take a lot of hits in your head by the time you become a pro athlete. And my physiology never made it. I was never professional of anything. I mean, I played high level sports, but I was on the B team driving them on to greatness. You know what I'm saying? So
Yeah.
I had a lot of disabilities that based on my brain injuries that I really couldn't compete at a high level. So yes, yes, and yes.
So let's say active player. So if let's say we're an active player who's playing college or pro sports and you get a concussion, you're in concussion protocol. Is photobiomodulation, infrared technology being used during concussion protocol? And obviously, I think the answer is going to be yes, it should be used, but is it being used?
Yes, it is being used. I can't say for 100% that my devices are being used in there, but a lot of devices are being used within the professional ranks. And of course, that is probably like called a trade secret. So if you have a device that is like exercising the brain and that gives you a competitive advantage, I don't think you're going to come out and publicly, tell everybody, well, this is what we're doing. And they say, don't tell anybody that I'm using this. Like some of the people that I work with, they're like, don't tell people that I'm using this because I'm this and I don't want them to know that I got this and that.
Oh my God. I hate that. But like we have a lot of athletes, especially pro athletes who are like, I don't want anyone knowing I'm doing this. Like, okay. But okay, if we go to like, let's say we go now into middle school, high school athletes who have the potential to become great athletes and they suffer a concussion, or even if they don't suffer a concussion, would you recommend for them to be doing this as part of their care routine?
Well, let me put it to you this way. I had the California state champion lightweight MMA guy, champion of the state. And we came up with a concept called brain armor. So one of the things that you have to realize is that
what?
Brain armor. Like
brain
the helmet
armor.
doesn't helmet doesn't help you. The helmet doesn't help. The helmet can be a problem. But the brain needs to have the cushion. And that's the fluid. That's the fluid that we talked about. And so when I see the guy saying, oh, I just need to drink more water and I won't get concussions. Well, it's almost right. But in the sense that if you suffer a concussion or you slip on your head or you fall off your bike, okay, then that's an injury. And then if you have another one before you recover, you're in trouble. And then that's how CTE comes, is repetitive head traumas. So you need to start like protecting the brain before anything happens. And so when is that? When is before? If a child can have neuroinflammation at 6 months, right, that can lead to autism, when is it the right time to start reducing neuroinflammation in the brain? That's kind of the scenario. But that's kind of the whole, when you finish reading my book, you're like, oh man, I wish I had known this. Or if you go to the hospital, like, and we have a study going on in Cali, Colombia, at acute traumatic brain injury, ICU. And at the end, you wish that you could have done something to prevent these things, is the reality. But you don't, people don't talk enough about prevention because nobody wants to think about, their son being in the hospital with his skull cut off so that he can survive.
So back to the question, should every athlete, middle school, high school, young athlete, should they be doing this? And how often should they be doing this if they're playing contact sports?
Yeah. Even the flag football, even paddleball, you seem are innocuous, but they're getting hit in the head with the paddles. Well, how fun is that? I got hit in the head with the paddle. Didn't help me too much. The point is, if we want to focus on peak performance, we have to focus on the peak performance machine, which is right here.
Love
right?
it. Yeah.
Right. The body doesn't get tired. The brain fatigues. The body doesn't make reactions. The brain makes reactions. So if we want to be optimal and the best that we can be, if we're not focused on things that help the brain, which easy things are sleep, right? Proper nutrition and inflammation down, all those things that they're talking about now that, we wrote a book, a few years ago that was explaining all these lifestyle things, right? I agree with you And the answer is, from my perspective and from being a clinician and from being a patient and from being a caregiver, yeah, I wish I would have started this earlier, because that's where the gains come, right?
So let's say I'm a middle school flag football athlete. Should I be doing this once a week? Should I be doing this every day? What does a protocol look like for prevention of injury for this?
I say that, when does prevention start is if you don't have a problem. And if I look at a 15-year-old high school or whatever that is girl, their mental health is not very good. So I don't care if it's depression or, all these things. Their mental health is not well. And what are you supposed to do about that? Well, the point is that photobiomodulation is good for the brain. And the brain is the seat of your emotions. It's the seat of your humanity. So I don't think that it's preventing anything besides maybe suicide, right? Because these kids are not well. And what can help their brain get better? Photobiomodulation. It can help them emotionally. It can help them physically. It can help them mentally, helps them socially. I mean, I take care of teachers.
Yeah.
And they're like, you don't want to be in school. These kids can't sit still. If I'm staring at my phone at 11 o'clock at night instead of sleeping, do you know what I'm saying?
Yeah.
Where are you going to
Your
go with
rhythm's
that?
messed up, the blue light, all of that. But so what protocol would you recommend? Is this a daily, like use it every day, 20 minutes? And I know it's individual, but like for people who are listening, I feel like they're going to be like, okay, I want to do this. How do I do it?
Like, it's very simple. You buy the device, it has a button, turn it on, and you leave it on for 20 minutes. And it's best to do it just before bed to help your wind down. It helps you reduce the stress and everything like that. Pumps the blood into your head so that you're ready to have a good sleep. Because when you're sleeping, the brain fills with fluid and it goes away with fluid, and it goes like that, and it cleans out all the gunk that you thought about. Thinking takes energy, and it has waste products. And that's when the downtime is when the brain heals. That's when neuroprogenitive cells come through. That's when the immune system kicks in. That's when it flushes out toxins. So that's kind of the scenario. Like, if you're not sleeping good, you're not going to have a good brain.
Yeah.
That's it. And so, what helps you sleep? So it's kind of like the same scenario as, like, if you give an old lady a cream and she puts the cream on and the wrinkles go away, is she not going to buy more cream? Right? So she's going to use it. So that's kind of the whole thing. Have a sleep tracker, do the metrics, watch the sleep improve, watch the behavior improve, and then do it. You can miss a day. You're not going to die, but more is better than less.
Okay. So one last question before you have to head out. And this is one that I'm just curious about. What are your thoughts about, let's say, 10, 15 years from now? What is going to be the future of photobiomodulation and the attention on the brain in terms of how much more brain training, is there going to be 10 to 15 years from now compared to right now? Where do you see the future?
So that's let me paint with a broad brush. First of all, let's look at different age groups. So we know that there's a tsunami of cognitive decline that's happening in the world right now, and it's only going to get worse. So that is when people are going to lean on not only lifestyle changes and the awareness of the brain, but they want to be able to measure what's going on, and they want to be able to see it improve. And that's where the bio data is going to kick in and allow us to treat a lot of people at home at a relatively, economical rate compared to, like, it's $20,000 for the first month of, lockup dementia care, right? So what are you going to do? Right? So we're going to be forced to address this brain health problem for the elderly, right? And for our young, and for the people in the middle that are working, taking care of both of them and have to pay for this. So I believe that we're either going to be forced to take care of this, or, we're not. And we're just going to get deteriorate as a society, right?
Yeah.
Think about this. Long COVID slows the brain. And who doesn't have some form of long COVID nowadays, right? So what's the next one going to do? So I think when we look at this and you see what it's already done for these type of, post-viral mental fatigue. It's what it's about. So they're going to be looking for solutions. And I think that's what we've been building for the last 10 years.
Well, that's going to be great for you.
It's going to be great for everybody, right? It's going to help people
Well,
be better.
at least there's solutions out there. And I think, this is why I'm super grateful for your time, your energy. This is something you've been working on for many years. I'm going to link all that information down below. So if anyone who's listening wants to take care of their brain better, wants to test their attention, get their focus improved, you'll have the information down below. Just look down at the captions.